Everybody, I'm back today because I wanted to share with you, I really want to use this experience of hip replacement to educate people from the yoga's perspective of how to recover from hip replacement or really any illness or surgery. And it's interesting because when when you have a hip replacement, you're given a laundry list of things that you're going to need post surgery, just some ideas what to expect. You can Google all of that. Your surgeon will probably give you a packet that tells you you're going to need an ice machine, you're going to need a grabber, which is a fantastic tool. I don't have my grabber with me, but helps you get your pants on. So you don't have to have anybody help you with your get your pants on. Or if you drop something on the floor, you can easily pick it up because remember, we have those precautions when you have a hip replacement that there's no bending past a 90-degree, which is the biggest one. For me, another one that's really hard, the precaution that's really hard is the crossing of the legs. For years, I crossed my legs. Like when I sit down, I cross my legs. And for years, when I was struggling with hip pain, that's about the only position that really gave me relief and comfort was crossing my legs. So just as I'm sitting and doing computer work or reading or something, I find that I want to immediately cross my legs. So I have like this thing in my head that says, don't cross your legs, don't cross your legs. And those are all like things that any surgeon's going to tell you. Ice machine, grabber. I have to wear the wedge for 10 more weeks, 12 weeks total at night to prevent me from crossing my legs and things like that. But those are kind of universal. I want to pop on today and talk about some of the things that I have found using those eight limbs of yoga to bring into my healing process and just how my daily life is going using my yoga lifestyle because it is a lifestyle. We don't do yoga, we become yoga and it becomes part of our essence. And so something that I've been doing every single day since the going up to surgery, but for sure, once I woke up from surgery, is I'm spending time every single day thanking my body for accepting the joint. It's not that I close my eyes and have a meditation about it. I just spend some time in the morning with my hand on my hip thanking my body for accepting the joint and trusting that my body's going to do the right thing by this joint, that my body's going to heal around it. It's going to find comfort with it. It's going to build a relationship on an energetic level, that my joint becomes part of me. And I think our mindset is huge in this. So, again, like we talk about mindset all the time in my classes, I could choose to spend my day in fear that I'm not going to heal because I have so much pain, or that my joint's going to fail, or that my immune system's going to reject it, or that I'm going to get an infection, or I could look at all of the things on the internet that can potentially go wrong with a hip replacement or any surgery. Or my mindset can be gratitude. It can be inviting this into my life in a way that I'm going to heal and I'm going to heal well, but there's going to be an energy behind just the actual healing that's physical. There's going to be an energy in my body that says, this is good and this is where I need to be. So, mindset is everything. And I really try to have gratitude on a daily basis for my body doing exactly what she needs to be doing right now, which is resting when she needs to rest, having pain when I need to have pain. You know, it hurts a lot. I get messages every day. How's your pain? My pain hurts. It hurts. I don't know why I hurt so much, but I do. I do. And I'm trying to not focus on, oh my gosh, I hurt, to my body's feeling this for a reason. And she's doing what she needs to do to heal. So I'm not dwelling on the pain. I'm not fixated on the pain. It is what it is. I hurt. And what can I do to redirect my thoughts, to know that my body's doing what it needs to do to heal? And that's where I put my focus, mostly on gratitude, and then shifting my mindset to talking really kindly to myself, which leads me to the second thing about healing. And when we're sick and we're vulnerable and we are relying on people to do the things that we do for ourselves every day without thought, we have to remember kindness goes so far. not only speaking kindly to ourselves and being tender with ourselves on this journey, but the people around us need kindness. They're having to do things that they haven't ever done before. They're having to step up their game. And we have a tendency as human beings to take out our frustrations on the people closest to us. And to truly live this process of recovering from whatever hip replacement, illness, knee replacement, back surgery, whatever you're dealing with, to remember that kindness goes so far and that we're speaking kindly to ourselves, but then we're also speaking kindly to the people that are helping us. And that's from waking up in recovery and your surgeon and your staff of care on the medical side, your family that is going out of their way to bring you things that you would normally just go get yourself, your animals that mine are attached to me. And rather than being frustrated by that, I'm being kind to them because they're intuitively saying, Mama's hurting and I'm going to sit on her lap and bring her comfort. Gets a little old sometimes, but I'm kind to them. So kindness goes so far. And then one of the things that I've chosen to do, and this isn't my first time in the rodeo with a surgery, but I make a deliberate choice to, regardless of how crappy I feel, to get up every day and have my daily routine. My daily routine consists of journaling, gratitude, coffee, lots of coffee, using my essential oils, putting makeup on, putting clean clothes on every day. I don't wear pajamas every day. The day I got home from the hospital, I was getting dressed. Like, I'm not going to just sit in this place where I'm hanging out in my pajamas all day, not doing my hair, not putting makeup on, not having the daily routine that I know is so important for me. I feel better when I do that. And so I would encourage you to not be the sick, laid up person and instead start to take those steps to being the vibrant person that you are. And that if that's doing your hair and curling it every day, or putting lipstick on, or doing your daily routine, anything that you did prior to your illness or surgery, go back to that as fast as you can because that's going to make you feel better. And when we feel better about ourselves, we're more likely to take care of ourselves and do what we need to do on that path of healing. I think for me, one of the gifts, they tell you in the surgery packet, get your house ready. I live in a tri-level, so I have a lot of steps. And so having done this before a few times, I knew I didn't want to be in the lower level of my house. It's not as welcoming, it's not as warm, it's not as cozy. So this time around, I chose to kind of make my home base my office, which some of you know was my childhood bedroom that I lived in this house when I was growing up. So this was my bedroom for 18 years until I moved out as a young adult. And so there's comfort here. And I've set my space up. I have snacks in that basket right there. There's my cashews back there. I have healthy snacks that are totally accessible. I can get to them anytime without having to ask somebody. I've got a huge bookshelf over there right by my reading chair where I can grab some of my favorite books, my journals over there. I have crystals. I have a whole bunch of oils. I have oils up here. That's my sort of my stash. If my everyday favorites are over there and I'm like, maybe I should whip up something else. They're right here. I have everything that I need right here that I love and enjoy that bring me not just happiness, but they bring me healing too. So making sure not just that you're moving area rugs that you might trip over, but making sure the space that you're going to spend the most time in is warm and it's comforting and it brings you happiness and joy. So I set my room up. I did a lot of organizing before my surgery, making sure that I have diffusers. I have a beautiful teapot that a dear friend gave me, a basket of tea. I have instant coffee. Should I decide I want an afternoon coffee, I don't have to try to stumble downstairs and do all that. I can stay here if I choose to. I have tons of plants. There's a beautiful plant here. And then right by my window, I can see Pikes Peak, I can see blue sky, and I have amazing plants that just bring life into my space. So that's really important. And then the last thing that I have found to be super important in this journey of recovery is finding movement every single day. And, a lot of people know that I love movement. I love to walk a lot. I love to work out a lot. And I get this like cautionary, you're doing too much. You're doing too much. I'm not doing too much. I'm doing exactly what my doctor prescribed, which is walk every day, not far, but just walk every day, do your PT exercises, and do what feels good. So for me, what feels good, the yoga practice that I shared with you yesterday, the 6 directions of the spine. I love to stand up at my desk and do a modified down dog, which is simply putting my hands on the desk, swinging my tailbone behind me, and coming into a 90-degree bend, like the shape of a letter L or a number 7. So I'm putting my body into that shape, and that feels delicious. Now, I could choose to sit in my chair all day in my pajamas with bed hair, thinking about how much I hurt, thinking about my pain, thinking about how horrible this is. Or I could be consistent with my daily routine, be consistent with gratitude, be consistent with speaking kindly to my body and my new hip joint, being excited about learning something new and reading some books that I've had in my bookshelf that maybe I'm returning to. I could choose, right? I choose to do all those things. And then the final thing that I have found to be a great redirection for pain is starting a new hobby. And you might think, oh, how can you start something new when you're trying to just figure out how to walk again with a new hip? Simple. Find something that you're curious about, learn about it, watch YouTube about it, try it. It's so good to learn something new. So I have a couple new hobbies, kind of newer to me. I've always been a planner. I've always had a paper planner. It's sort of been where I jot my life down. I create things there. I plan. I got a digital planner this year, and it has just been amazing. So I did a little digital download to my iPad every day. I set my day up. I don't do a lot. I'm home. I'm not driving to 50 million assisted living. So, what in the world would I put in my planner? Well, I put my intentions, I put my gratitudes, I put things I want to do. Like, I want to make sourdough crackers. So, I put that down. Like, anything that's I want to have my day look like, I put it in my digital planner. I find brainstorming ideas about classes I want to teach. That's been a new hobby. Always been a planner, but taking it digital has rocked my world. I'm also working on my crocheting that I typically don't have time for. So in the afternoon, I make a cup of tea and I crochet, not long, maybe 20 minutes. And then the last thing that I love to do is I've been learning how to make sourdough bread, and I've been doing this for a while. So it's not like a brand new hobby, but I've elevated it, and it just brings me such happiness. I'm making English muffins and pizza dough and pancakes, and it's crazy good, but it brings me joy. And I'm not, again, sitting in my chair, woe is me. This is terrible. I'm using mindset strategies, gratitude, hobbies, daily routines, making sure my space is warm and welcoming, finding little bits of movement throughout the day, and then speaking kindly to myself and others. That's how you heal from hip surgery. Okay. Your surgeon's going to give you all the practical stuff, but putting mindfulness into your healing process, that's where the game changes. And it's been helping me. So I encourage you, if you're going through something hard, if you have a surgery coming up, if you're dealing with a long-term illness, implement some of these strategies into your life and just see, how does that shift? Like, are you just smelling lavender once a day, or putting some lipstick on, or finding a jigsaw puzzle? Like, that's another thing I do every day. Every day I do a jigsaw puzzle on my iPad. It's perfect because it's taking my mind to somewhere other than fear, limitation, lack, pain. That's going to change the game. So implement a couple of these tips and tricks, and then let me know. Like, touch base with me. Tell me how your recovery is going, or your path to mindfulness. Like, you don't have to be going through something hard to put some of these strategies in place. If you're feeling like miserable in your life, like, I don't have anything going on in my life, put some of these strategies in place and just watch how your life blooms into something good. Blooms into something good. All right, I got more on this topic, but we'll stop here. All right, have a good day.